Good day, everyone. Welcome to the CSA Certified Skin Authority. I'm Dr. Contessa, your certified aesthetic physician here at the CSA Medical Aesthetics. In today's episode, we'll have the part 2 of our male and female nose aesthetics. There's a question. Is it okay to add on threads like after a couple of months? So we'll answer that question today. We have with us Pao. Hi, Pao.
Hello guys. Hi Do.
Hi. Okay, so if you recall, we did a non-surgical nose enhancement for Pao. And when was that? How many months ago?
That was last
Like
May.
about
7 months.
7 months already. So we have some questions from our mga CSA. Okay? They are asking me how early can you add threads, the Hyco threads that we have used before. So Pao is here with us. It's been like 7 months.
Yeah.
So let's have a review first, okay? So if you recall, we did a bridge enhancement here, making use of a combined filler and threads, right? And then also on the tip, we had a projection, making use of those threads, as well as a little bit of the filler. Okay, so we were able to achieve a very good enhancement, okay, for the bridge and the tip. So as you can see, okay, pa-side view tayo. Wow, yan. So still we have a very good bridge contour or height here. I could say na okay pa rin siya, maganda pa rin. Because those threads had induced a so-called tissue build-up, right? Let me ask you, Pao, how was the experience during our first time that we did this thread lifting on you?
Well, to be honest, Doc, sobrang nag-lift talaga siya.
Yeah.
Sobrang tumaas ng 80%.
Right, yeah.
Yung tangos ng ilong ko.
Yes.
But then, I also
Yeah.
see na parang hindi naman siya bumabalik sa from original.
Yun, may
Parang,
tanong din.
ayun, yung parang tissue
Yeah.
build-up nga. So,
Right.
parang totoo yung parang hindi na siya yung babalik sa dati. Meron na
Yes.
siyang improvement from
Correct.
before. Or
Yeah.
enhancement, kumbaga. Yun.
Yan. So you were able to answer the question
Yes.
nung sa mga natin viewers kasi baka after naman pong mawala nung threads, babalik dun sa original
Hindi.
form.
Hindi talaga.
Yeah.
May difference talaga.
May difference.
Mhm.
Okay. So we've heard that from
Yeah.
Pao. Okay. So if we assess ngayon na po, ang ang napansin ko na lang is the lower part. Okay, yung dito. Parang a little bit na nag-downturn na siya. Unlike nung bago natin ginawa, it's really upturned pa eh. Maganda yung pagka-project ng tip eh. Kasi I always explain then to my patients right now na kasi yung upper part made of the nasal bone.
Yes.
So it's a firm foundation. So maganda yung steady yung mga products inside. Yung mga threads natin, yung filler, tapos yung build up ng tissue, mas steady sila. Kaya lang, when we go to the lower part ng ating nose, it's cartilage. So, softer structure po kasi ang cartilage. So, hindi ganun ka-firm yung foundation. So, even sa mga na-surgery na before, yung mga halimbawa nagpa-Gore-Tex or silicone, ang nananotice lagi is like after certain time, parang medyo yung sa dulo, bumababa. Yun yung concern nila.
Yes.
Parang hindi ganun ka-perfect na naka-project or upturned yung tip. Kahit yung may mga na surgery na naglagay na rin ng cartilage. Kasi nananotice namin, yung ito ngang ibaba, ayun,
Parang
parang
nagiging
droopy. Yun. So parang, so yung tip ni Pao, siya yung i-enhance natin ulit ngayon. Mas magpo-project na tayo sa tip. So, we can add threads na as early as, like, I have patients na as early as 3 months. Kasi if they still want it higher, pwede pa.
Yeah.
You can still add on threads. Kasi this is non-surgical eh. You are just injecting. And then, wala naman siyang ganong kahabang downtime.
Wala.
So, hindi ka worried na you'll be having a long anong tawag doon, yung sa trabaho mo.
Long break, wala namang long break.
Yun. So,
Balik work.
right. So, ito, add-on lang. So, inject lang ulit. So, parang you wanted to boost lang. So, yun nga, as early as 3 months. Pero I had a patient na as early as 1 month po nagpa-add kasi gusto pa ng mas mataas. Gusto pa ng mas, ano talaga, lifted. Yan. Pwede naman po yun because these are materials, we like compare them to like a protein fiber or a protein filament. So safe naman po. Okay, so nakasagot tayo ng mga questions,
Yes,
ha?
go.
That's so nice. So I think we'll proceed doon sa actual procedure. So more of a tip projection sa ating male guest, Pao. Kasi later on, we'll have again our female guest. Kasama rin po ni Pao, si Ma'am Maisa. We'll also assess din ano yung post 7-month procedure dun sa kanyang nose enhancement. So ating abangan yan sa pagbabalik ng CSA Certified Skin Authority. And we're back mga ka-CSA. So we are now at the actual procedure of the part 2, nose enhancement, okay, for Pao. Okay, so yung male nose aesthetics po natin. So this is post 7 months. So we can already add on some of our threads, okay? But it's just gonna be a minimal enhancement lang po. So I did an injection of the lidocaine. Right now, I'll make a point of entry, okay, making use of a gauge 19 needle. And then I make use of my dermal filler as numbing also dahil meron siyang lidocaine. So, I'll still make use of a minimal amount lang ng ating dermal filler, okay, with a cannula here. So, actually, I make use of a gauge 25 cannula. Okay, poker please. So, expected lang po na we have some pinpoint bleeding on the tip. Because yung nasal tip po natin, there are vessels here. So, actually, right now, I can sense yung resistance na. There's really a succal tissue formation. Kasi whenever we do an add-on, when we insert our cannula, there's some form of resistance. There's a build-up already of those tissue fibers. Okay? So, Pao, di ba, you can feel may resistance, right? Yeah. Okay. So, medyo lang, okay, some kind of discomfort lang po in inserting this one. Okay. We're still gonna be careful. Okay, there you go. So, I'll just use this filler, a little bit of pangano lang natin po, contour. Minimal lang. So, again, I'm using a hyaluronic filler with a lidocaine. And we know hyaluronic is natural. It's very safe. Okay. As simple as this. Just like actually, I'm just inserting like a 0.2 sa bridge. Okay, and then tip projection again. So, I will use the same entry point and insert towards the anterior nasal spine. Okay. Because among Asians kasi, we have a flat nasal spine. Unlike yung mga Caucasians po, it's elevated. Sa atin po, medyo, yun nga po, it's really flat. Okay, so we have to project that part para po lumabas yung columella and yung nasal tip. Okay. So, I'm more of injecting slowly with my dermal filler. Okay. So, ideally po, slow injection lang po. So, we have to be very gentle also. Okay. So, again, the goal here is to lift this part of our nose. So, kay Pao, it's more of a tip enhancement talaga. Kasi okay pa yung kanyang nasal bridge. So, I needed to insert at least mga 0.3. Kasi a while ago, we already injected 0.2. Okay. So, with just the dermal filler and injecting into the nasal spine, you can already project the nasal tip. You can bring it out. So, I'll add some of the Hyco PDO threads. Okay, same entry point lang po. Okay. So, gentle insertion because we already have tissue formation inside. Okay. See? So, again, I'm using a PDO Hyco thread. So, compared nung una, mas madali ang insertion eh. But now, there's really yung tinatawag naming remnant tissues. And we really expect some bleeding sa nasal tip. Yan. So, in terms of adding threads, kasi they will ask mga ilan kayang threads. So, it's variable depending on the shape of the bridge. So, case-to-case basis po kasi we have to harmonize everything. So, some of my patients, we add on 5. Yan. So, like for Pao, we'll make use of our 5. And if we still have some more space, we can still project it eh. Pero yung kay Pao kasi, there's already too much of a resistance. So, that's the limit na po. Okay. So, depending on the available space pa. Okay. So, it's not po yung like you ask me, ilan pa pong threads, doktor, ang i-add ninyo. So, it will depend po talaga kung ilan pa yung kailangan. At yung parang available space pa po dun sa ating nasal bridge. Because we cannot really make it too much kasi kung wala ng space, di ba? Yan. And we still consider po yung mga blood vessels. We don't want any compression of those blood vessels. So, tip project na po tayo. Okay. So, this time, I'll make use naman yung mga short, again, short threads. So, actually, I can already see a very good tip projection for Pao here. Okay, there you go. So, bleeder lang po ang ating male guest. Okay. So, tip projection, making use of a short PDO thread. I'll pinch the columella. You can breathe through your mouth. Okay. So, the idea here is to have it reach the nasal spine again. The one that we needed to really project. Okay. And that's 2. Okay. So, we already gave 2 projection. Okay. So, what we do right now, we have to make the bleeding stop. Then, we'll reassess yung outcome ng kanyang nose enhancement part 2. Okay, ating ipakita po ang results sa pagbabalik ng CSA Certified Skin Authority. We are back mga ka-CSA. So, we are now the part of the female nose aesthetics. Okay? Let's welcome mga ka-CSA, Miss Maisa.
Hi!
Ayan po. So, we had Maisa during the part 1 of the male and female nose aesthetics. So, let's assess. Okay, nasal bridge, still with a good height. Okay? And then, the last time, I think we had focused more of the tip area. Kasi rounded tip tayo, right? And then, actually, looking at the bridge, medyo ano siya eh, wider looking din, no?
Yeah.
Yun yung naging pinaka-concern natin kay Maisa noon. So, how do we make it narrower? How do we make the tip less rounded? That was the goal before. So, with Maisa, so yung experience mo nung part 1, kamusta naman, Maisa?
Okay naman, Doc.
Yeah.
Yung sa pag ma-compare mo yung before and after pictures, nakita mo talaga yung difference.
Yes.
Especially dun sa bridge and
Bridge,
sa nasal
right.
part.
Yeah.
Dun sa tip part.
Yes, yung sa tip. So, ngayon, that was 7 months ago.
Yes.
So, pwede na nating i-enhance. We can do an add-on of the thread to further narrow this. Kasi actually, those PDO threads that we left, they have an absorption time. Nag-hydrolyze kasi sila for about like 8 months to, yung iba pa nga, it's like up to 12 months The polycaprolactone naman, much longer. It can hydrolyze in 12 months to 18 months, and there were cases even up to 24 months. So, kay Maisa, there will still be this tissue build up. Okay, so I can see her height of the bridge, okay pa siya eh. So again, tip projection. That's the reason kasi I'm explaining again, yung soft tissue kasi sa tip eh. If you notice kasi yan, 7 months ago na, most of my patients are messaging me rin. Doktora, yung sa tip parang bumaba na. It's because of the cartilage. It's a soft structure. So even yung mga na-surgery talaga, that's the concern that they will tell us. Okay? It's understandable naman eh. And the thing is, yung nasal spine natin sa baba talaga po, flat kasi. So yung mismong bone sa bottom part, so nakababa po. Unlike yun nga, the Caucasian's elevated. So again, we'll do a projection of the tip. Okay, I'll start with so kanina po, nag-numb na ako. Ngayon, I need to do an entry point. Okay, I'll make use again of our dermal filler. I love combining filler with the threads because at first the filler gives further contour and it has a lidocaine, so it will help us in numbing the area. And I use a cannula para po less yung injection natin. Unlike with the injections of the lidocaine, we inject here and then you come out too much of a bruise. So it's much more of an advantage if we use the cannula. Okay? So again, there's a resistance already. It's because of the tissue formation during the first treatment we had 7 months ago po. Ayan. So, Maisa has a longer type of nose. Kasi some women have a short nose. Pero kay Maisa, para siyang Caucasian eh. So, yan. I have to really reach that radix part. So, a little bit lang. Again, minimal amount. They always say less is more. Okay, mga 0.2 lang. Okay. I can add a little bit pa dun sa pinaka-radix. Because when we do this, we really have to make it balanced looking. And straight. Not deviated or crooked like. Okay, so just minimal there, and then the important part that we're gonna do right now is the tip projection. So I still have to reach the anterior nasal spine. So this is not a simple procedure po that we're doing. So we always advise you to go to your certified aesthetic doctors who are trained to do this. Okay. So sorry Maisa ha, I really have to insert the cannula up to the nasal spine. So pressure lang. Okay, there's pressure there. Okay, so I have the nasal spine already, and then pushing some of my filler. Okay, I can inject as much as 0.3 ml of my filler. Then we'll proceed with our threads. Okay, so far so good. So the important thing is we have a good filler injected into the nasal spine. So again, the question of how many threads do I need? So, depende po. It depends on the needed number of threads again. So, case-to-case basis po ito. Hindi po siya yung parang one size of a shoe fits all. So, iba-iba po tayo ng sizes, di ba? Di ba, Maisa?
Yes, no.
It's not pare-pareho. Hindi naman po pare-pareho ang shape at size ng nose natin. So, dun po sa laging nag-i-inquire, pag second treatment, magkano po or ilan po. So, we have to assess or check. Okay. So, kay Maisa may space pa eh. So, that's okay already. It's a good shape already. Kasi elevated pa rin yung kanyang nasal bridge. Okay, so tip projection, that's the important part. Okay. I make another opening there. And then use my short threads. Okay, pinch ka columella again. Then up to the yan, meron ding resistance naman sa kanyang columella. Okay. Because this part meron pong yung cartilage sa septum. dito sa columella part. So with Maisa, I can add some more. Kasi feminine nose dapat mas projected eh. And it has a nasolabial angle of about 100 degrees or 105 or 110. Sorry Maisa. This lang, the last one. Then we can already reassess if it's okay na. So every after procedure, you need to check again. Okay, yan. So, we're done with the nasal enhancement for Maisa. Okay, amin pong ipapakita ang mga results sa pagbabalik ng CSA Certified Skin Authority. And we're back mga ka-CSA. So, we are now about to show to our guests the results of our procedures. Let's start with the first one, Pau. Okay, mirror. Ayan. Okay.
Oh, wow.
Wow, right? Yeah.
Grabe, Doc. Sobrang
Pronounced.
pointy na talaga siya.
Yeah,
Yung
pointy.
tip ko.
The tip.
Tapos
Correct.
yung, ano ka din, yung, what do you call
Bridge.
this? Yung bridge.
Yeah.
Na, naging, ano siya ulit, na-enhance.
Na-enhance ulit.
Sobrang,
Naging defined.
sobrang naging defined siya. Wala akong masabi, Doc.
Right.
Sobrang galing.
Yes. And of course, sa ating female guest, si Maisa, ito mirror. Yan.
Wow.
Right?
Super laki na difference dito sa...
Yes, the tip again. Kasi rounded pa rin kanina. So ngayon, na-reduce natin yung pagka-rounded. Kasi feminine nose, dapat ano pa rin, pointy tip pa rin. And narrower nose. Okay. Even yung sa sides, if you notice, because you were able to project it forward, mas lumiit.
Yes.
So may parang allor narrowing effect na rin siya.
Yeah,
So,
actually,
ayan.
yung nga din napansin ko, Doc. Nung first time din, nung
Yes.
ginawa, medyo
Right.
naging medyo lumiit.
Yeah.
Now, nung bumalik ako, parang mas sakto siya talaga.
Correct.
So, parang okay
with the
talaga
repeat.
repeat.
Correct. And with this second treatment of Pau and Maisa, it will be best, it has a, what do you call this, second layering na po ng ating mga thread fibers. So yung unang na lagay po natin, nag-induce ng tissue build-up. So you're doing a second layering na po ng tissue formation. So, lalo mong may stimulate yung dati nating ginawa.
Yes.
And yun yung longer lasting, yung na-build up natin na sarili mong nose tissue, yung sarili mo ng laman sa nose. And actually, yung female guest din natin before, nakapag 3 sessions siya, and she visited me one time, and mga 1 year na rin yung interval. At first kasi talagang flat yung dito niya. Pero right now, nung nakita namin siya, talagang meron ng laman. May sariling laman. So, yun yung sinasabi naming longer lasting effect. Okay? So, you just add on a year after, 2 years after, or kagaya sa inyo, 7 months later, yung iba nga 1 month later. It is okay. It is safe na mag-add on ng po. So, it's just injection.
Yes.
So, binuboost mo yung previous treatment. So, mas na-stimulate pa po natin yung natural tissue build-up.
Ako, Doc, just to add, yung tinitignan ko yung pictures ko last year,
Yeah.
yung first visit ko sa inyo, nakita ko talaga yung difference from before to now, na parang iba na talaga. Iba na yung pinaka-nose ko
Nose,
from
yes.
the very beginning
Right.
na nagpunta kami here.
Wow.
So, iba talaga yung difference pag
Wow.
nagpunta kayo kay Doc Contessa.
Enhanced talaga yung...
Enhanced talaga yung magiging look.
Pero it looks natural pa rin.
Yes.
Natural looking, and it boosted your confidence eh. So, even my patients are sharing with me nga na iba pag na-enhance.
Yes.
And then, sobrang confident nila to face their friends, or if they work in a business company, yung mga clients
Yes.
nila.
Yes.
So, yung self-esteem tumataas and nag-i-improve lahat. When
Totoo.
you really
Totoo
look good, you really also feel good
Yes.
about yourself, right? So,
And si Doc Contessa kasi, yun nga, like I've said dun sa video ko ng una, iba talaga yung eye ni Doc. May eye talaga siya for
Right.
beauty. So makikita niya talaga yung difference and enhancement na magagawa niya sa nose niya.
yeah, kasi yan din yung ina-explain ko, there's a need for individual assessment.
Yes.
Dahil nga po hindi tayo pare-pareho ng size and shape of our nose.
Yes.
So kung nagtatanong po kayo kung ilan yung idaragdag, ano po yung magkano po. So, we still ask for your, ano rin po, yung isend nyo sa amin ng inyong photos for an assessment lang po. Ayan po mga ka-CSA. So, nating natunghayan ang part 2 ng male and female nose aesthetics. Kung meron pa po silang katanungan, you may email us at csaskinclinic@yahoo.com, our FB page Messenger CSA Derm Centre. Our clinic is located here at the second floor, Pure Gold Dau Building, Dau MacArthur Highway, Mabalacat, Pampanga. Contact number 045-331-1117 or 0917-504-4268. And yung mga iba naming videos, okay, sila Pao and Maiza, meron silang previous video. If you wanna check it, nasa aming YouTube channel, just type Contessa Salvador. And please do not forget to click like and subscribe as well. Okay, salamat po sa inyong lahat. Pao, Maiza, thank you very
Thank you,
much.
Doc. Thank you so
Nasagot
much.
nyo yung mga tanong
Yes.
ng marami sa ating mga viewers, okay? So mga ka-CSA, when it comes to natural beauty, you can trust the CSA Certified Skin Authority.